Hello, this is Rashi Sahai, and you're watching MediCircle. Today, on our Children's Health Awareness series, we have Dr. Rajkumar Paul with us. Dr. Rajkumar Paul is a renowned consultant pediatrician and child specialist in Guwahati and is currently practicing in Pratiksha Hospital. For the past 10 years, he has worked as a consultant pediatrician and child specialist. Welcome to MediCircle, Dr. Rajkumar Paul.
Hello, Rasi, and hello, everyone. It's nice to be here.
Gastroenteritis is a very common condition among babies. However, a parent is constantly concerned because their baby is constantly crying because of stomach gas. So let us understand why there is gas and how to get rid of it so that your baby can be happy. So, doctor, my first question is, what are the symptoms of gastroenteritis?
So, gastroenteritis, as the name suggests, gastro is a term for the stomach, and enteritis is just medical term for the intestine, and itis means inflammation. So, gastroenteritis means inflammation of the stomach and intestine. So, the symptoms are like due to the stomach inflammation, there will be vomiting. The child will not be willing to eat, and due to the enteritis or the inflammation of the intestine, there will be loose stool, pain abdomen. Sometimes there might be blood in stool also. So those are the symptoms of gastroenteritis.
Okay, doctor. So can you please tell us some causes of gastroenteritis?
The most common causes of gastroenteritis is infection, or it might be due to inflammation due to some food products or some toxin ingested along with food. Among the most common causes are infection by viruses like the enterovirus. Entero means stomach, as we discussed. So stomach infections or the intestine infection by the viruses. Then comes your infection by some bacteria like Salmonella and Shigella. Then comes some ingestion of toxins during child playing, taking something into the mouth. That can also cause inflammation of the stomach and intestine.
Okay, doctor. So how long does gastroenteritis last in child?
So the symptom starts in about 24 to 48 hours of ingestion. The most common reason of transmission is fecal-oral. Sometimes eating something, the bacteria or viruses or the toxin may go through mouth, through the food, or through some during play or mouthing activities it might go. It starts 24 to 48 hours after ingestion of the substance. And the symptoms last for about 3 to 7 days. Most commonly resolves by 4 to 5 days.
So, what are the various complications due to gastroenteritis?
The complications are many, but to note and to remember are two. One is dehydration. Dehydration is due to loss from the body by the means of vomiting and loose stool. The fluid and electrolytes from the body get lost, and body goes into the state called dehydration. Dehydration is the most common complication. In India, we lose many kids due to gastroenteritis, and it is one of the two most important reason of losing morbidity and mortality among the childhood patients. So dehydration, that is losing salt and fluid through vomiting and stool. The other complication is passing of blood and stool. So only if there is blood in stool, we need antibiotics. If there is no blood in stool, we usually don't recommend antibiotics in treatment of gastroenteritis.
So, how to get rid fast of gastroenteritis in babies?
So to get rid of something, the most important thing is knowing the thing. So primary, it should start from prevention. Knowing that hygiene practice is very important. The number one, when we practice hygiene, you decrease the chances of gastroenteritis by 80%. But don't be too hyper about it, but practice minimum basic hygiene. Number one, be careful what the child is playing with, because the child will inevitably put them to their mouth. And then the second thing is that if there is a symptoms of gastroenteritis, we should seek help early. Like the treatment consists of simple medications, like we give the zinc, we give probiotic. Sometimes we get an antiemetic, which is a medicine to decrease vomiting. But the most important medicine is ORS. The Hindi name for ORS is Jiban Rakshak Ghol. ORS. It is a life-saving. everyone should keep ORS in their homes. And whenever you travel, take ORS with you. This ORS really saves life. It is a consist of larger packet and small packet. The large one is to be mixed with 1 liter of water. The smaller one, 200 ml of water, and give it frequently. And always remember, ORS, there should be WHO written on the packet. So ORS, zinc, and sometimes we give probiotic and antiemetic, that is vomiting medicine. Only these 4 medicines can treat gastroenteritis to the tune of 98%. And beside that, you give small frequent feed, because obviously the stomach infection child will not be willing to eat. Give small frequent feed, give various food products, but don't give too complicated food which is difficult to digest. Then we don't have more restriction in food, but I recommend not to give eggs, meat, and not to give too much milk. Other than that, they can take everything. And only if you go through these things, this gastroenteritis will be improved in 3 to 5 days.
Okay. So on MediCircle, our main focus have always been to provide the audience with large amount of information, and that too in a less time. So today we will be conducting a small question answer session in which you could answer in yes or no, or either in 1 or 2 line sentences.
Okay.
Yeah. So my first question is that does gastroenteritis occur only in night?
No, it can occur throughout the day.
So is yogurt good for gastroenteritis?
Very true. It's actually good because it has a probiotic for lactobacillus. It's good for gastroenteritis.
So can gastroenteritis spread through the air?
The primary modality is fecal-oral, means through the mouth, through food, oral route. But yes, sometimes it might spread, but those are rare occurrence. The most important reason will be oral route.
Thank you so much for coming to our show and sharing your valuable time and insights with us at MediCircle. It has been a pleasure having you on the show. Thank you.
Thank you, Rasi. Thank you, everyone.